Okay, I will call this meeting to order for the Board of Health on November 22nd at 10 a.m. And I will ask for the roll call, please.
Thank you, Madam Chair. Sue Carlton,
Present.
Ryan Milne,
Present.
Kevin Eccles,
Counted for.
Chris Peabody,
Present.
Sue Patterson,
Present.
Helen Claire Tingling, Helen Claire Tingling, Helen Claire Tingling, Kenneth Craig,
Present.
Nick Saunders, Nick Saunders, Nick Saunders, Chad Richards,
Present.
Beverly Wilkins.
Present.
Thank you. Welcome, everyone. Are there any amendments to today's agenda? Seeing none, the recommendation is that the agenda be approved by the Board of Health as presented. Could I have a mover and a seconder? I'll go to Bev and Chris. Is there any discussion? All in favor? That is carried. Thank you. Is there any disclosure of pecuniary interest? Seeing none, you may declare at any time during the meeting if one should arise. Adoption of the minutes from Friday, October 25th, 2024. The recommendation is that the minutes be approved by the Board of Health as presented. Could I have a mover and a seconder? Ken and Sue, is there any discussion? Kevin? Okay. I will call the vote then. All in favor? Is carried. Correspondence and media releases.
Madam Chair, we have on the list of correspondence 5 items. The first one is a letter from Peterborough to the provincial level, Ontario, the Premier, Minister of Child Community and Social Services, and the Minister of Education. And the gist of the letter is to encourage the Ontario government to enhance its support for adequate funded student nutrition programs. And that's through 2 mechanisms: negotiate and sign agreement with the federal government and address increased government funding for these programs. And the recommendation there is to receive. The second item is a letter from the municipality of West Grey to Ontario Premier, and the letter is supporting the Temiskaming Shores resolution to request the province to reverse its decision to allow alcohol to be sold in more locations and implement certain recommendations. And the recommendation there is to receive. The third item is a letter from the municipality of West Grey and to the Premier of Ontario. And the letter supports the municipality of St. Charles motion that supports the motion for public health Sudbury district and encourages the Health Canada to take immediate action to close the regulatory gaps that prevent the sale of nicotine pouches to youth, among other interventions. And the recommendation there is to receive. We did plan to endorse them to these measures. And subjects, not just element. And the fourth item is letter from the County of Bruce, the health unit. The letter basically informs the Board of Health of the county's intent to fill its vacant positions in December 2024. And the recommendation is to receive. The final letter is from Windsor Essex County Health Unit. And it is a letter directed to partners in general, not only to the Board of Health. And in it, the health unit for the board looks at the recommendation from the direction from the province in 2023 that 3 items of business will be implemented. One of them is voluntary murder. The other one is an increase of 1% for 3 years. And the third one is to focus and shift towards prioritized core activities. And the letter here outlines the health units or the board's intention to focus on these 3 priorities and basically create comprehensive health promotion and substance use department or reform the operations of the health into these three departments. One of them is comprehensive health promotion. The second one is independent immunization department. And the third one is enhancing its resources to respond to emergency management. And it's worth mentioning those are within the standards and the competencies for public health. And we do operate on all three of them. The letter here is more or less to notify the partners that the health unit is moving with that core functions on these three. I don't see how the standards, the rest of the standards can be not completed. They must be completed. Nonetheless, this is just communication that they are concentrating on those as well. Open to questions as always, Madam Chair.
Okay, thank you. So the recommendation would be that we actually receive all of these items. Are there any of those that any member of the board would wish to pull and deal with separately? And go ahead.
Through you, Madam Chair. Thank you, Dr. Arrow, for that report, particularly about the letter from the Windsor Essex County Health Unit. And I was wondering what sort of metrics or thresholds the county, Windsor Essex would use to, move them towards implementation of that health promotion and substance abuse or developing a new independent immunization department. What sort of, what's the information they use? What sort of place do they have to get to in public health provision to generate enough momentum, enough internal thought process that says, well, we need to not do this, but as well as doing this, this is now the focus. And I'm wondering if Dr. Arrow can speak to that.
Certainly, through you, Madam Chair. In public health, we don't have much margin we don't have much latitude to change what we do. It's prescribed in the standards of public health. So we must complete all these standards. We can prioritize certain things to advocate for example, currently our top priority is the opioid crisis and mental health. So we are putting it up front. Nevertheless, immunization and anything that's way less priority must be done. The standards need to be completed. So again, back to Windsor, I can't speak for them specifically, but my understanding from the letter and communication with their MOH is the changes based on the direction from the ministry. The ministry in 2023 said you need to focus on these three issues, basically in public health, and we're gonna update the standards, review the standards. The standards being reviewed right now, and my understanding, the old standards will be effective in 2025. The new standards will be after. That's one of the updates, and then I'll speak to later. We don't have much latitude in saying we're going to focus on this and we're not going to do this. We have to do everything, but with a bit more emphasis on certain things. I don't know if that explains that.
So if, just as a follow-up, thank you, through you, Madam Chair, of course. If this is the direction that the province Ministry of Health has indicated that all public health units should direct their energies, are there policies that our medical officer or health would suggest we address to, like Windsor Essex, if this is the focus the province wants, are there policy small shifts, whatever they are, that can make the provision of services in Great Bruce more aligned with the ministry direction? Do you see anything that we might address in a very specific fashion to allow public health to do its job the best they can?
Through you, Madam Chair, nothing that we have not been given. So since the direction came out, whether it's on the budget or on the voluntary market, we explored both. We managed actually not to have a group layoff, which other health units didn't. There are group layoffs in many other places, in many other health units. And with these priorities, they are within the standards, so we are completing them. And there has been, over the past 9 months, I would say, more work on the emergency just to align with what the ministry is asking for. So these things have been done for us.
Okay, thank you.
Are there any other questions about any of the items of correspondence? Seeing none, the recommendation is that the correspondence be received by the Board of Health for information. Could I have a mover and a seconder, please? Chad and Ken, there's no further discussion. I will call a vote. All in favor? That is carried. On to media releases, and welcome to me.
Thank you, Madam Chair, and through you, there are 3 media releases on this month's agenda. On October 31st, Public Health sent out a media release after issuing the 24th opioid alert of 2024. This alert came in response to a suspected fatal opioid-related poisoning that took place in Owen Sound on October 28th. The release encouraged people who use unregulated drugs to always practice harm reduction strategies and to be aware of the toxicity of the unregulated supply. Public Health also issued a media release on October 25th as part of a potential rabies animal exposure investigation in Erin Eldersley. And finally, Public Health issued a media release on October 21st to help raise awareness of the government-funded programs that are available to assist eligible seniors with the cost of dental care. This release was part of a collaboration between Public Health and the County of Bruce. And that concludes the media release portion.
Thank you, Denise. Does anyone have any questions on any of those items? Seeing no one, the recommendation is that the media releases be received by the Board of Health for information. Could I have a mover and a seconder, please? Sue and Brian. And if there's no further discussion, I will call the vote. All in favor? That is carried. Medical officer update, the first one being the opioid situation in Great Western with the scanning item.
The chair, this item continues to be similar to the previous 2 updates I provided. All the operations on the opioid situation, working with partners to address the crisis, continue. There's nothing significant to report compared to the previous ones. The second item, Madam Chair, strengthening public health. My last report was about the review of the standards, and the communication we have received initially from the ministry that the standards will be updated and ready early 2025. The last communication we just received from the ministry saying we need to continue to use the old standards for the year 2025, and the new standards will be applicable for 2026. So from that point of view, there is consistency in the way we deliver the programs. Our planning for next year will be easier since we basically did not change the standards, and we'll see what comes from that update. The third item, Madam Chair, with your permission, I will turn it to Andy if there are no questions on the previous 2 items.
Okay, any questions on those first 2 items? Seeing none, then we will turn to you.
Thank you, Dr. Arrow, and good evening, Madam Chair. So the report today is from the vaccine preventable disease team on an area of logistics that we perhaps don't often talk about, which is the cold chain maintenance compliance. So our vaccine preventable disease nurses, obviously during the sort of busy respiratory season, they are busy delivering vaccines, but then part of the year they also deal with inspections of the cold chain and ensuring that the system in place is effective. So the key points in this report: vaccines are sensitive biological products. They have to be very carefully handled to maintain their potency and stability. That includes protection from light, extreme shocks and things, and particularly extreme temperatures. So cold chain is the term that refers to all the materials, equipment, processes that manage that and keep those vaccines in that key area between about 2 and 8 degrees Celsius. And that's right from the time that they're manufactured through to their actual use. So the purpose of both routine and instant cold chain inspections is to ensure that the publicly funded vaccine inventory is properly managed. It helps to provide strategies to minimize vaccine wastage, acknowledging that these are expensive products. And it also promotes vaccine safety and effectiveness. So in 2024, our staff have completed 164 annual inspections of fridges and freezers. That includes the units that we have direct control over, the health units, but the vast majority of those are fridges that are in the various partners across Grey & Bruce. So the majority now of infant and childhood immunisations are provided through community-based primary care providers. And actually now, last year's flu season, the majority of Canadian adults are also vaccinated against influenza at pharmacies. So these are obviously really key partners to ensure that those fridges are working optimally. So those are the key parts. Any further discussions or questions?
Thank you. Any questions from anyone regarding that report? Ken, go ahead.
Through you, Madam Chair. Thank you, Andrew, for the report. Who owns vaccines when they're in the fridges, when they're in the cold chain? Does Grey Bruce Public Health buy the vaccine, or is it just put there by the ministry? Or because the question comes down to who bears the loss when there is a loss, and what are the acceptable, not that you want any loss, but what are the acceptable standards for loss and loss prevention strategies? Can you touch on that a bit, please?
Dr. Aaron may have more information on some of this, but I can certainly give some information. So these are publicly funded vaccines, so we're not directly paying for these vaccines, but obviously we as taxpayers pay for them. Government pharmacy buys them, and obviously we don't really have control of them until we receive them. Although it is possible to have vaccine cold chain failures during transportation, and that is certainly a challenge that has happened. And then obviously once we have them, we have control of them. It's on our own units, and then they get moved to those various partner units as well, where we don't have direct control, but the cold chain process is there to ensure that they're working as well as possible, and that any wastage is minimized.
For you, Madam Chair, I echo what Andy mentioned, the vaccine program is provincial. The province owns the vaccine. We help in distribution and advice and ensuring the cold chain. And there's a lot of details into how we can help the partners, whether it's primary care or even sometimes pharmacies access to consultation. We don't deliver to pharmacies. They have their own channels. That's only the differentiation in between the two programs. But the vaccine that goes through the health unit is owned by the province. The percentage of waste, like you said, our goal is to bring it to zero. The thing is, we don't have control over all steps in the process. When it is in the fridge, in a primary care, family physician's fridge, we do visits, we inspect the temperature, we give them advice, but what happens there can happen there. And how much has been administered to patients versus wasted is not recorded by us. The best probably way to get that proxy number is at the provincial level, when they know that they distributed 1 million doses, and in the OHIP, for example, billing, there are 700,000. That's probably the closest to it. We don't look at these numbers. We look at the numbers that we have. Many of these partners that we deliver to can report that this expired, we need to dispose of it. So that comes back to us, and we help them with this. But not everything is done that way. There is 100% control over the process. And it's not by design from us, rather that's a provisional program.
Did you have a follow-up, Tim?
I'll wait if there's another question from somebody else, that's all.
Does anyone else have a question? Chad, go ahead.
Yeah, thank you, Madam Chair. And through you, do we have any historical data on instances of cold chain failures, like comparative to previous years? Is 2024 with 56 reported incidents an outlier, or is it kind of par for the course when it comes to what we typically see from year to year? Thank you.
Who wants to take that?
I will have to bring back the answer for this one, Madam Chair.
Okay.
Just to be clear.
Ken?
Through you, Madam Chair, there's just a comment here. Rapid reporting ensures individuals are not immunized with non-viable vaccines. And I appreciate the public health takes care and caution of all the immunizations. What I think I read in here, there's because the cold chain, wherever it broke out, I'm not trying to say RSNM or anybody else, wherever it broke down, a vaccine that is not viable does not provide any health risk to anyone who receives the vaccine. It's just that it's not effective as a vaccine. That's what I read in the report. Is that an accurate statement?
I'm sure that's an accurate statement. Yes, vaccines by design products are given to healthy individuals. So the bar to approve a vaccine is way higher than the bar to approve a medication where we would expect certain level of adverse events or adverse effects. And it's worth mentioning that we have redundancy in the system to protect the vaccines that we have. Like one example is we have freezers that would send text messages to the person on call when the temperature changes. We have a generator if the power goes off. We have communication with the hospitals where they can send their vaccines, or communication or arrangement with the emergency with the counties if there is power outage and we need to store to run our generator and we need more fuel. All of these redundancies are built in. So for vaccines to expire within the health unit because of an error internally, it is very unlikely.
That's smart freezers.
Just a question then, on those generators, is there a yearly maintenance check or a monthly maintenance check to ensure that they're gonna kick in when needed? No, yeah,
Yes, Madam Chair.
yeah, okay. Any other questions there? Seeing none, the recommendation is that the medical officer of health update be received by the Board of Health for information. Could I have a mover and a seconder, please? Ellen, Claire, and Kevin, there's no further discussion. I will call the vote. All in favor? That is carried. And we are now on to corporate services and the financial reports on him.
Through you, Madam Chair, this is the September 30th, 2024 financial updates. As of September 30th, we had a surplus of $486,000. Seniors dental surplus made up $145,000 of that, and the remaining programs had cumulative surplus of $341,000. The lump sum mortgage payment that's approved at the last Board of Health meeting for $300,000. So we're going to utilize most of that amount that's sitting there at the end of September. For funding, our revenue continues to align with our budgets. We have received an increase in funding for the Healthy Babies, Healthy Children program, and interest income continues to be above budget, due to the rates remaining high in 2024. Similar to prior months, our salaries and benefits are still under budget, primarily due to the gapping in vacancies in some of the positions, but we still have active recruitment going on for multiple positions. For the operating expenses, the program managers have all working with their teams, and a lot of the program spending started to happen in October, November. So we should start to see some higher usage in some of those lines, so the professional development, budgets for spending in September, was over the amount for September, so you'll see that variance start to go down, and the materials and supplies has some higher utilization in October, and we'll see that probably running until the end of the year. Has any questions?
Okay, thank you. Are there any questions? Seeing none, we can move on to the risk management report.
You, Madam Chair, as part of our annual third quarter report to the Ministry of Health, we are required to disclose the high risks identified as being managed by the Board of Health. So we've worked through the figure one of the memo. Is a list of the 4 high risks that we've identified for the health units. The first 3 are high risks that were on the report last year. So there's similarly financial pressures relating to the base funding increase of 1%. So that hasn't changed from last year. We've also identified the risk, of a cyber breach or cyber attack, what the impact of that could be to the organization. And there's also the ongoing risk of the change in provincial direction regarding the organization of public health and what that would mean to our operations that would have a substantial impact. And we've also added a 4th one regarding the ability to attract qualified professional frontline staff in a couple of our frontline positions. We've various, like our inability to offer permanent positions, our rural location, of course, a small pool of qualified candidates. So that was the newly added this year. So we're sharing that for information, and then this will be submitted to the Ministry of Health as part of our report.
Thank you. Any questions? Seeing none,
No,
go ahead, Karen.
trying to be fully here.
That's okay.
Through you, Madam Chair,
Okay.
thank you for this report. In the municipal setting, our emergency management plans follow the whatever that stands for, but it's a risk assessment similar to this. From a community basis, there are both internal and external risks that we address. It appears in here that most of the, particularly the high risk events, are not really health events. It's not another pandemic. It's not a hurricane or something like that. Are those risks identified that we just farther down the list and we didn't see them, or is that a risk that, or these risks specifically those that can happen to the internal organization and effectiveness of the health unit? Can you speak to that, please?
Through you, Madam Chair, so that's almost an entirely separate process that we have. So we have our emergency management program that identifies the risk that you're saying to Graham Bruce County residents, and then analyzes those high risks. They have the HIRA and all those pieces under the emergency management program. So the risk report here has an internal lens. So internally as an operation, what are the risks that we're facing? And then for public health and the residents of Grey Bruce, what are the risks that's covered under our emergency management program?
So you've identified the 4 highest. Can you give us a sense of what the 2 way down on the list that are, like, even though they're identified, they're so low, it's like it's improbable. These I can understand these really well. Can you just give us like an example or a sense of what 2 of those really low risks? They're risks, but they're so low that they didn't make the chart. Is there one that comes to mind, or?
Through Madam Chair, so like in the entire risk register, there's tons of them because there's, I think, 8 or 12 different risk type categories. So under financial, you could have lots of them. So risk of financial loss due to fraud, but then your risk would be low. You start listing all of your internal controls that you have, your segregation of duties, your dual signing authorities. And so because of all those controls, your risk is actually quite low. And so we go through all those from human resources, privacy, IT, political, all those different categories. You identify all of them, you identify the controls that you have in place to get there. So it would be quite a long list of
Okay.
others.
All right, thank you.
Madam Chair, it's worth mentioning too, it's the same, underlying principle to the, question about or the discussion we had about the Windsor letter. This is prescribed, this risk management process comes from the ministry, we need to go through the whole items. And I do believe it's very inclusive to many items that should be included. And the lens is corporate assessment of this corporation specifically, not the groups and learning stakeholders.
Thank you. Kevin, you had your hand up there.
Yes, and I guess that, I think Dr. Era just kind of answered it. It's prescribed that we have to do it. Does the ministry set out what the risks are and we do it, or we we identify the risks ourselves and submit the list?
So, your Madam Chair, yes, the ministry prescribed that they sent actually an Excel sheet that we cannot change. So the risk of items there, and I do believe it's a very good tool, like I'm saying, you can change, but to be universal across the province and be used everywhere. We can change the level of risk that we experience, but the tool itself is I don't think it can manipulate it.
Not the sheet, the bigger one.
Right, so it is prescribed, but again, I do believe it's a very effective tool, but it's in the Alpha meetings, they do sessions on how to fill it and how to assess the risk in organizations, and almost every item and teaching about the subject is captured by this tool.
Okay, does that answer all the questions there? Anything further?
Not for me, no.
Okay. So the recommendation is that the financial report for September 2024 and the risk management report for 2024 be received by the Board of Health for information. Could I have a mover and a seconder, please? Ken and Kevin? Is there any further discussion? All in favor? That is carried. That is the end of our business, so I will call for adjournment. You have a mover and a seconder. Beth will catch you this time if that's okay. And Chris? All in favor? That is carried. We are now adjourned. Thank you, everyone.